And 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 I am going to share because I think you wanted me to share, correct?
Yes, if you don't mind.
Yeah, no, I don't mind at
You
all.
can be our Vanna.
I'm gonna be your Vanna. Okay. Let's see if I can, not used to using this one, but presenter view. Okay. Although for some reason it wants to do this little thing here. So hold on one second. Okay. Does that work? Can you see that?
Yes.
Yeah.
Okay, so again, uh, welcome to Heather and Ricky. They're going to be talking about what's happening in DC with Medicaid, education, and other concerns. And for those of you who came in late, Heather and Ricky, if you don't know them already, they work within the policy with the National Down Syndrome Congress. All right, so I am going to hand it over to you, Heather, because I think you're first.
I am. And as Brooke said, hi everyone, I'm Heather Sachs. I live in Montgomery County, Maryland, DC area. I have 3 kids, and my middle child, my daughter Leia, has Down syndrome. She is almost 20. And I actually became really involved in the Down syndrome network of Montgomery County when she was about 3 years old, served on the board for many years, started the first advocacy committee there, and then helped a bunch of advocates in Maryland get the Maryland Down Syndrome Advocacy Coalition up and running. So it has been it's been a journey, and we're always happy to come back and provide information and education to our local groups. Ricky, do you want to just briefly introduce yourself, and then I'll go through the agenda?
Sure. I'm Ricky Sabia from Olney, Maryland. I have 3 children. Well, one is a daughter-in-law, but I consider her one of my children. My oldest son is a general educator in Montgomery County Public Schools. My daughter-in-law is a special educator, and my son Steve works in a doctor's office. He's 33 years old, and he is my son with Down syndrome. I was co-president of DSNMC back when Steve was a little guy, before it was even called DSNMC. And then I was on the board of DSNMC much later for 6 years. And I also did the training that started the Maryland Down Syndrome Advocacy Coalition a long time. I think it was back in 2009 or something like that. And now I am the Senior Education Policy Advisor at the National Down Syndrome Congress, working with and for Heather.
All right, so just a pretty basic agenda. We're starting off talking about Medicaid. Then we're going to talk about what's going on with the Department of Education. I'm going to briefly touch on other concerns. Seriously, I mean, it's like whack-a-mole these days. So there are a lot of other concerns, particularly regarding the Social Security Administration, the Administration on Community Living through Health and Human Services, what's going on with HUD, Housing and Urban Development, the National Institutes of Health. And we're going to talk about what you can do as advocates. And as I said, we've built in quite a bit of time for questions. So let's talk about Medicaid first. And thank you all for hopping on in the evening time. Not the most exciting topic to discuss, but a very, very necessary one in this environment. So let's go to the next slide. Just wanted to talk about the basics of Medicaid first. A lot of folks don't realize that it's a joint federal and state program. It's actually the largest healthcare program in the country. About 83 million people use it, including 17 million older adults and people with disabilities. It's actually the survey was done several years ago out of Boston that showed almost all adults with Down syndrome do use Medicaid services of some sort. So I thought that was pretty interesting. It really is vital for our community. A lot of folks don't realize that it also provides funding to schools to cover services such as speech therapy, behavioral health, and more. This is through the Medicaid expansion program, which came out under the Obama years during the Affordable Care Act. And it's not just students that are on Medicaid that benefit from this funding to schools, it's all students, because if a school is using Medicaid funding to hire an extra school counselor or speech therapist, then all students with IEPs benefit from that. Each state runs its own program with broad federal guidelines. These guidelines are put out by the Center for Medicaid and Medicare Services. There are baseline rules that states need to meet, but in general, they have a lot of flexibility for good or for bad. That's why you see some states with very long waiting lists and some states with no waiting list. And we'll talk about that in a minute. What some people don't realize is that Medicaid is called something different in every state. And we've been finding this actually as a challenge with our advocacy efforts because a lot of people don't realize that they're on Medicaid. So in Maryland, it's called Maryland Medicaid. That's pretty easy. I know we've got someone from Kansas on. In Kansas, it's CanCare. In California, it's Medi-Cal. In Alaska, it's Denali Care. So it really is called something different in all 50 states. And people may not realize that the services they're receiving, whether healthcare or through waiver services, are actually Medicaid services. So we need to be informed about that so we know what we're fighting to protect. Medicaid covers a wide range of services for people with disabilities besides just medical care. And that's, again, something that a lot of people, including the legislators, don't seem to realize. So these home and community-based services that folks get through their waiver, things such as job training and supports, transportation, personal care assistance. If you have someone come to your house to, help you get, help you get dressed and help you with hygiene, and that all comes from Medicaid waiver services that are not necessarily healthcare related. And I'll talk in a minute about why those services in particular are going to be on the chopping block first. Let's go to the next slide. So as I said, Medicaid is a federal and state partnership. The Center for CMS sets the guidelines. There's minimum eligibility standards and benefits. And what they do mostly is provide a ton of funding. It's FMAP, which is an acronym, like there's so many acronyms in Washington, but it basically stands for the federal match. And CMS typically provides 50 to 70%, 75% of Medicaid funding for each state. So that is a very, very significant amount. So when we're talking about cuts to Medicaid on the federal level, it absolutely impacts the states. The states now are going to have to either make up the difference from the state budgets or drop services or change eligibility criteria to get people off of Medicaid so the state can save some money. The federal role also approves different state plans, waivers that your state offers for home and community-based services have to go through CMS for approval. But the state really has a bigger role in terms of the day-to-day Medicaid programs. They administer the program. As I said, they just need to meet some minimum guidelines, and then they can, create their own rules, their own waivers, and they really have a lot of flexibility with this already. Let's go to the next slide. Okay, so this is something that a lot of people don't realize, and this is why I said home and community-based services are really on the chopping block with what's going on in Congress, which I'll talk about in a minute. So according to the Center for Medicaid and Medicare Services, you can go back, Brooke, if you can. There are certain benefits in Medicaid that are mandatory and certain benefits that are optional. If you could go back one slide, Brooke. So the mandatory benefits are designated by CMS, and these are really the baseline benefits of Medicaid programs that all states absolutely have to cover. So things, and they're medical, mostly medical based, hospital and physician services, transportation to medical appointments, lab, x-ray, nursing, family planning, although some states tend to define that very differently depending on the state, and then EPSDT, that's the early intervention screening, diagnostics and screenings that we often see for school-aged kids. Those are non-negotiable. That is in law that states have to cover that. Where we get into trouble now is that there are a lot of optional benefits that states may cover, and things such as prescription drugs, dental, vision. I'm not going to go through the whole list, but assistive technology, environmental assessments where they'll come out to your house and, kind of figure out what your accessibility needs are and make recommendations for that. Career exploration and employment services, which so many of our adult self-advocates use, respite care, care for caregivers, and non-medical transportation. That's your, metro access or whatever, rehabilitation and medical daycare for people with, more significant medical needs. Those do not need to be covered. And so as now we're talking about cuts on the federal level, all states will have to continue covering these mandatory benefits, and it is the optional benefits that are on the chopping block. Let's go to the next slide. Just really basically, in Maryland, the Maryland Medicaid program, the coverage here includes all of those federal mandatory services and many optional services, including, prescription drugs, dental, behavioral health, vision and eyeglasses, personal care, and case management. This differs in every state. Let's go to the next slide. So Maryland has several different waiver programs. The names kind of keep changing every couple of years, but the gist of it is they have several different waiver streams that you can get into. They can be traditional waiver programs, so where you're using a provider, or they can be self-directed. And so again, within these waivers, different optional benefits are covered. Let's go to the next slide. And then just briefly, many of you have been in Annapolis with me this last legislative session, fighting tooth and nail to get the budget cuts restored for Medicaid. We actually did get a lot of the money back that Governor Moore had proposed, cutting from particularly the Medicaid waiver services. I didn't put statistics for fiscal year 2026 because it's set to end in the end of June. But for fiscal year 2025 is almost over, but for fiscal year 2026, we are still seeing some significant reductions to DDA services in Maryland, the Developmental Disabilities Administration. We've fought to get money back. We have gotten money back, but there's still going to be a significant impact, and services in Maryland will be reduced. The most significant would be relating to residential supports in homes with dedicated one-on-one staffing. That's the most high need individuals that need round-the-clock care. There's some very negative changes to self-directed services in Maryland. And, we're seeing now that the state is looking for other opportunities to cut. This is going to be an ongoing budget battle every year. But I must just say that I was really proud of the way the Maryland Disability came together. We raised our voices, we pushed back, and we got a lot of money restored to the budget that originally was going to be cut. Let's go to the next slide. Okay, so let's talk about the current situation for Medicaid. Republicans in Congress are pushing for major Medicaid cuts. I'm sure you've all been watching the news, and they're basically trying to pass a bill that will fund tax cuts, defense, and border security as the president's three main priorities. And they're pushing for major Medicaid cuts as well as cuts to other social safety net programs to pay for this. They're using a process called budget reconciliation to fast track these major cuts. It's a really complicated process. I'm not going to get into it on this webinar, but just know that it is not typically used. It's not a traditional path to make such major cuts, but they are going forward with this. A couple of weeks ago, the House of Representatives passed a budget resolution, which is basically an order for the various committees to make cuts to the programs they have jurisdiction over. So each House committee has jurisdiction over certain social and government benefits programs. It just so happens that the House Energy and Commerce Committee has jurisdiction over Medicaid. So the House passed a budget resolution with 800 and essentially ordering the Energy and Commerce Committee to make $880 billion of cuts in the programs that they oversee. Well, the programs that they oversee, it's the money that they oversee is mostly Medicaid. So there's no way that they can meet this $880 billion order to cut, to make those cuts without making significant cuts to Medicaid. So the disability community was really advocating against this budget resolution, which did pass. Unfortunately, advocates that were calling offices were getting the runaround saying, well, what are you talking about? Medicaid is not even mentioned in this bill. We're not cutting Medicaid. Anything else can be cut. Well, the Congressional Budget Office, which is a nonpartisan entity which scores things, will basically tell Congress how much a certain bill will cost, came out immediately and said there's absolutely no way that Energy and Commerce can make these $880 billion in cuts without significant cuts to Medicaid. So that was just kind of smoke and mirrors. What's happening now is all of the committees are getting together and writing the policy details. They're essentially writing their bills. And we're absolutely going to see Medicaid, in black and white in these bills. But advocacy is really, really important because it's going on right now. Let's go to the next slide and talk about what cuts might look like. So there's quite a few types of Medicaid cuts on the table. There's the cuts to that federal match. Remember, we talked about how the federal government puts up 50 to 75% of funding to state Medicaid programs. So there's outright cuts. There's, cuts to the percentages of the match. There's cuts to Medicaid expansion under the Obama years with the Affordable Care Act. The eligibility for Medicaid criteria changed in many different states. Most states have adopted a Medicaid expansion population. That means that these are not necessarily people that would have qualified for Medicaid under the traditional disability route, which is, very, very low income, below the poverty level, or significant disabilities, through disability or the elderly. However, most of the people in this Medicaid expansion population are people that are either caregivers, our direct support professionals who are supporting our folks, our adults to live and work and access the community, or students. And data has shown this, that, most people in the expansion population are not, white male adults sitting at home playing Xbox. Most of the expansion population works as well. And so that's interesting. The federal government is also talking about limiting the amount of money that states can tax providers. So within each Medicaid program, you have handful of providers of services. In Maryland, when you sign up for, when you are deemed eligible for Medicaid, there are 5 or 6 different providers that you can choose as your main provider, and the state taxes those. And so that is a source of revenue for the state. However, some of the cuts on the table are to the state's discussions of the state's ability to tax that. And so that particular source of revenue stream may be significantly diminished or taken away. Per capita caps is also being discussed. That means that each state would only receive a certain pre-designated amount of money per person on Medicaid. And so there's absolutely no flexibility in that system at all. It does not account for people whose needs change, people that come onto Medicaid, that move into the state, et cetera. So it essentially functions as a block grant where the state receives a certain amount of money from the federal government and they can't go back and get more. And then what is very heavily being discussed and what I think is most likely to happen are work reporting requirements. And I wanted to just take a minute, let's go to the next slide and talk about what work requirements are. So in theory, they sound great, right? Let's, encourage people to work and be self-sufficient. Again, we don't want those adults sitting around playing Xbox doing nothing, right? Work requirements are policies that would require someone to work in order to maintain their eligibility for Medicaid. And they are problematic in many, many ways. First of all, the data shows that almost everyone on Medicaid is already either working, looking for a job, or serving in a full-time caregiving role. Okay, so people are already working. The work requirements has actually been tried in 3 different states already, and they have been an absolute disaster. It has been shown by these states, particularly in Arkansas. There's a whole case study about this that you might have seen floating around, that millions of people were kicked off of Medicaid due to work requirements. Work requirements contain very confusing if you think there's a lot of red tape now in Maryland and across the country, wait till work requirements are imposed. They prevent a lot of hurdles, quite honestly, because people tend to get kicked off of Medicaid if you're not filing the right, you're not filing the right things, or if you can't get a job, which affects many of our folks with disabilities. And it's, as I said, it's basically work requirements are just another cut. And that's what people in Congress discussing that, they know this. And that's why they're talking about, imposing work requirements on Medicaid. Now, remember, before you panic, let's go back and talk about state flexibility, right? So we talked about how Medicaid is a state and federal partnership and how the state will have a lot of flexibility about how things are implemented. So even though, we haven't seen the bill yet, we don't know what it's going to look like, but even if it comes out and passes and says that there have to be some sort of work requirements attached to Medicaid. Let's recall that, here in Maryland, there is going to be some flexibility with that, and that will be another advocacy opportunity for sure. Let's go to the next slide. So work requirements are especially bad for people with disabilities. And again, so many of the talking points that we're hearing when advocates call their members of Congress is, oh, don't worry, work requirements are not going to apply to people with disabilities. There's going to be a carve out. You're going to be able to certify that you are not, quote unquote, able-bodied, so you are not able to work. This is a major problem for several reasons. First of all, people with disabilities are stigmatized enough, and we are trying to get more employment, not less. And so to have people say, I can't work, then, significantly diminishes their employment opportunities, and it also majorly disincentivizes them from seeking work. If you decide not to opt out, well, first of all, to get this exemption, you're going to have to file a lot of paperwork. Okay, so that may not go through for some people. If you are not seeking the exemption, again, there's going to be very complex reporting requirements like we talked about, and it places a massive administrative burden on the state and individuals. I know in Maryland with the self-directed services, and there's been a huge administrative burden anyway with some of the vendors, and we're going to see that get even worse with work requirements, because work requirements will necessitate a whole new reporting system. The data, again, it's been tried in several different states, and it shows that it absolutely does not improve employment. And in fact, it disincentivizes disability employment. So work requirements are not good for people with disabilities, and having a carve out in there is not going to be very helpful. Let's also go back and talk briefly about the Medicaid expansion population, who will absolutely be susceptible to work requirements. And those are the folks that are providing care for our loved ones, adults with disabilities as well. So, so their Medicaid will be in jeopardy with this. Let's go to the next slide. Okay, so remember when we talked about there are mandatory Medicaid services and there are optional Medicaid services. So when the federal government makes cuts to Medicaid, however they're going to do this, and there will be some cuts made, we're putting up a great fight, and I'll talk a little bit about some advocacy successes later, but rest assured in this environment and essentially with no checks on Congress, there will be some sort of Medicaid bill that passes that cuts Medicaid. States are already, their state budgets, as we discussed with the Maryland DDA cuts, are already very strapped. And so when the federal government is giving the states less money, it is up to the states to find money in their budget to make up the difference. And the state has to pay for these mandatory healthcare services first. So then where does the state cut money from? The state is going to be cutting money from the optional services. And the optional services under Medicaid are these home and community-based services, which are also called waiver services. So unfortunately, we're going to see a lot of services cut. We're going to see eligibility criteria change for various waivers. We're going to see wait lists for these services grow. And in some states, folks can wait 5-10 years on a wait list to get services, and those wait lists are going to get longer. I think, to me, at least the most scary thing is we actually may see a rise again of institutionalization as a result of cuts to home and community-based services, because HCBS really allows people to live in the community with whatever supports they need. And if folks are not, lucky enough to have family members that they can go stay with, the state is going to have to find a place for them. And the place is, institutions, whether they're to the traditional institutions or, more of a group home model. This is going to cause a rise in that. Let's go to the next slide. All right, so things are moving very, very quickly on Capitol Hill. The Energy and Commerce Committee, which again is the committee that has jurisdiction over decide how much and how to cut Medicaid. They're in heavy discussions now. I have to say our advocates are doing a great job. We keep delaying the process for them. They were actually supposed to mark up, when you mark up a bill, it's you're discussing and debating a bill and submitting amendments. They were actually set to mark up the bill this past week, and they had to delay. We have heard that the Republican conference is in absolute turmoil over this Medicaid issue. This has become a wedge issue. They are hearing from their constituents. The phones are ringing off the hook. And that's a good thing. People are sharing their stories. And we're going to talk a little bit about what you can do later on. So as of now, next week is a critical week. They're set to release the bill. They only have to release the bill 36 hours in advance prior to a markup. And so, look for, quick summaries of the bill, and we're, all waiting, but we're also trying to delay it. President Trump and Speaker Johnson are really putting a lot of pressure on the Republican caucus in Congress to finalize these bills and make these cuts by Memorial Day. Hopefully that won't happen if we do our jobs right. We're just trying to delay things as much as possible here. Let's go to the next slide. Okay, so we are in blue state Maryland, and most of our delegation are Democrats. There is one member of the Maryland and all of the Democrats in the Maryland delegation have publicly come out recognizing the importance of Medicaid and come out protecting Medicaid, and are totally against the cuts. There is one representative in Maryland, Andy Harris, who is a Republican, and he favors massive cuts to the Medicaid program. And I know that MDAC has some folks in Andy Harris's district. It is super, super important for those constituents of his to get on the phone with his office and tell your story. Even if it doesn't change his mind, it will give him pause, and maybe it can minimize some of the damage if he really needs to hear from his constituents. The other folks need to hear from their constituents as well. where in some ways it may seem like preaching to the choir, but it's also really important for them to have real world stories. You might have seen a couple weeks ago, Senator Cory Booker from New Jersey did a 25-hour marathon filibuster speech talking about Medicaid, and he shared hundreds of stories that he received from his constituents from New Jersey talking about how important Medicaid was to them. I'm in constant contact with Senator Van Hollen's office, and they've been collecting Medicaid stories as well. So it's really important as constituents for you to, call, email your elected officials, let them know that, you appreciate their support for Medicaid, and tell them why Medicaid is important to you. And we'll give you some specific tools and easy shortcuts that you could use at the end of this presentation. Let's go to the next slide. Okay, so as I said, the advocacy is working. And let's just, go back down memory lane to the last Trump administration when they tried to cut Medicaid and also tried to gut the Affordable Care Act. Advocates were successful. We pushed it back. The Affordable Care Act is still in place, for good or for bad. Fully recognize that there are a lot of problems with it, but it also covers a lot of people that otherwise would not get healthcare coverage. So we have done this before, and we can do it again. As I said, the most important thing is just to keep telling your stories and keep that pressure up on the lawmakers. And let's not make this easy for them. Let's go to the next slide. Here's some NDSC Medicaid advocacy tools that you can use. We have an action alert, which will get you directly to your member of Congress. There's talking points, sample language in there. You can call and or email. I would recommend doing both. We have an explainer with frequently asked questions about Medicaid. This dispels a lot of the myths and pushes back against some of the talking points that we're hearing from the Republican side about Medicaid. So I encourage you to look at that. NDSC has been collecting a lot of Medicaid stories and sharing on social media, and we are about to unveil in the next week or so a Protect Medicaid video, which I'm very, very proud of, though had nothing to do with, where we've gotten advocates from all across the country to share their stories and the many different ways in which they use Medicaid. So as much as you can, amplify these efforts, contact your elected officials would be great. And it's not just in Blue, Maryland that we can do this. There is a power of the constituency, but we all have friends and family in other states. So, it's most important in these days to contact Republicans. And, that's just the way it is. So if you have friends or family in red states or particularly in purple districts, it is super important for you to encourage them to contact their legislative officials. If they have their own story to tell about how they use Medicaid, that's great. If they don't, they can share your story. I had my parents who live in a purple district in Pennsylvania call on behalf of their granddaughter and talk about how important Medicaid is to my daughter's future. And so, please think beyond just our immediate, blue state, Maryland. Think about all of our networks throughout the country and how we can leverage that. And with that, I'm going to turn it over to Ricky to talk about the Department of Education.
Okay. Thank you, Heather. That was great. You were reading my mind when you talked about the fact that even though we're here in Maryland, we have friends and family who live in other states and places. I reach out to my extended family in Arizona all the time and other places. So we're going to start talking about the U.S. Department of Education. And, you may already know all of this, but it's very important because there's a lot of misinformation about what the Department of Education does and what it doesn't do. So there's the Office of Special Education Programs. And through this office, the Department of Ed issues regulations and guidance that help states understand how to implement the Individuals with Disabilities Education Act, IDEA. It distributes the IDEA funds to the states. It funds important programs such as the Parent Information and Training Center, which in Maryland is Parents Place, and also teacher training. It monitors states so they comply with IDEA. And that's when you get letters to your state saying whether your state did or did not meet requirements. And there are different results that happen if they have not made requirements for a couple of years. It provides technical assistance to states, so gives them, gives them information that helps them implement when they are having problems and even when they're not. And it enforces some consequences when the states do not follow the law. The technical assistance for state schools and families is very important. Some of you may be familiar with the TIE Center resources. The TIE Center was a TA center on inclusive education for students with intellectual disabilities specifically. And that money came from a technical assistance grant. They still have the resources on the tiecenter.org website, and we also have a document from NDSC that you can go to with all the different TIES parents briefs that I co-authored, and you can click on the links and find these different parent briefs. Next slide. So why is Department of Ed, we're going to refer to it as Ed a lot, essential for students with disabilities? Well, first of all, OSIP distributes over $13 billion annually in IDA formula grants, which are the grants that are determined based on different states' needs and provide the money, or at least part of the money, for supporting the early intervention, preschool, kindergarten through 12th grade, and services through age 21. It also monitors states to ensure they comply with the law. Within the Department of Education, there is the Office for Civil Rights, where people can file complaints, and that is supposed to enforce civil rights laws. The Office of Post-Secondary Education funds those inclusive college programs that a lot of you are familiar with, which we call TIPSIDs. And the Institute of Education Sciences, IES, you may have heard in the news about them getting some of their grants cut. They conduct research and they provide data so that people can determine what works and doesn't work in terms of educating students with disabilities. And also the Office of Elementary and Secondary Education, which implements the Every Student Succeeds Act, which is the Elementary, Secondary, and Education Act. So it covers all students, including students with disabilities, with a special focus on students who are in certain subgroups, including the disability subgroup. And so that provides Title I funding and other grants and accountabilities for all students. Next slide. So what does it not do? And the reason we're talking about what it doesn't do is because there's a lot of false information where there are claims that it's the Department of Education causing certain things to be taught in classrooms. So they don't decide what schools teach. There are statutory language that says they cannot determine curriculum. They cannot determine what schools teach, what books they use. They do not control how states train teachers. They provide funding for teacher training, but they do not design the training. And they do not develop or approve individualized education programs. A lot of parents are angry and they say, well, what has the department done for me? I have trouble with my child's IEP. Well, that isn't the fault of the Department of Education. So next slide. So what's the current situation? Well, one of the first things Secretary McMahon did was to issue a memo talking about the final mission. So she's been out there from the beginning saying her job is to get rid of Department of Ed and to close the doors on the place. Now, a lot of this we'll talk about that they can't actually do without amending certain laws, and that is not going to be that easy because with most laws, you need 60 votes to overcome what we call a filibuster, and we'll talk about that in a little bit. And for that, you would need every Republican and also at least 7 Democrats. So that's not so easy. But what they have done is greatly undermine Department of Ed by firing a lot of the personnel. So since inauguration, 4,133 employees at Ed has gone down to about 2,183 employees. And half of the Office of Civil Rights employees have been fired. and 7 of the 12 Office of Civil Rights offices that are regional around the country have been closed. We talked about the importance of the research and the data from the Institutes of Educational Sciences. Well, a lot of that has already been gutted. And I should point out that a lot of this funding was already appropriated by Congress, and that's not supposed to be stopped by anybody but Congress, but this is what's been happening. 900 million in contracts and grants have been canceled. And we're worried about the status of new and recompeted grants. There, for example, the TIE Center was going to recompete for that inclusive technical assistance center. We don't know if they'll be offering that grant again. There's a technical assistance center associated with the transitioning programs for students with intellectual disabilities. We don't know what will happen with that. So these are all things we have to really keep our eye on. Next slide, please. So these are some of the attempts that have been occurring to eliminate Department of Ed. There was an executive order on March 20th that said to the maximum extent appropriate and permitted by law that they want to close the Department of Education and return authority over education to states and localities. Well, the key words there are maximum extent appropriate and permitted by law, because they're not permitted by law to just close the Department of Education. There was a statute that created the Department of Education, which would have to be amended. And then also all the language in IDEA talks about Department of Education, OSEP, Secretary of Education. So it's not as simple as they're trying to make it sound. They say that they want to move the offices to other departments. For example, the Office of Special Education Programs and the implementation of IDEA would be moved to Health and Human Services, according to these efforts. And that's a big problem because that's a health, not an education department. And they've also gutted a lot of the departments, the department there that deals with disabilities. So I already explained this requirement that for these laws, they need in the Senate 60 votes to overcome a filibuster, which is a tactic that can be used to delay or block a vote. And they would need to have a lot of Democrats and every Republican in order, not a lot of Democrats, 7 Democrats, but that's 7 more than they're likely to get, as well as every single Republican to do this. And there have been efforts to do this before, as Heather said, and it's never gone over. And a lot of Republicans have not voted for it. Who knows what would happen now, but they also need some Democrats. The bills in Congress have been introduced there have been some bills in Congress introduced to eliminate or severely weaken the Department of Education. And I want to make the point that we're not trying to be partisan here when we say Republicans and Democrats. These are just the facts as to who is supporting eliminating Department of Education and who is not. Next slide. So these are some key bills in Congress now, and you should be able to click on them, not certain, but there are 2 IDEA full funding bills. These are introduced every year. Senator Van Hollen is a big proponent of this. He's been trying to get this done for a very long time. It has been very hard to get this passed. And the reason we need IDEA full funding is it's never been fully funded. In fact, it's been not even halfway funded what it should have been. There's Protect Education, the Ed Department Act. So there are some bills that have been passed to try to protect the Department of Ed. There are various bills to eliminate Department of Ed. Some are these just bills that say eliminated as of this date. Some go into more detail, like I said, about moving the Office of Special Education Programs over to HHS and other details. There are some bills that block grants the education funding, and I'll talk more about block granting later, but it's not a good thing, and I'll explain why. But these bills so far have excluded IDEA in terms of block granting. They talk mostly about the Elementary, Secondary, and Education Act. There are school choice bills that range from voucher bills, federal voucher bills, to bills for education tax credits. And so these are some of the numbers. You can look them up if you want greater detail about them. Next slide. Okay, and before I get into this one, I wanted to mention one thing I forgot to say. We are focusing on federal education, unlike Heather, who did do some about Maryland. I am not going to really hit on anything specific to Maryland because there was another presentation by MDAC which went into that state education information, and they have that presentation on their YouTube, MDAC's Maryland Down Syndrome Advocacy Coalition's YouTube, if you wanted to see that. So recently, just within the last week, President Trump has released his 2026 education budget request. It's what is called a skinny budget because all it really does is give a narrative description of the key funding priorities and what funding levels, but doesn't, and provides just some description, but it's very unclear what is meant by the language in this skinny budget. And he is supposed to put out a much more detailed budget, and we're waiting to see the information. The FY 2026 budget runs from October 1st, 2025 to September 30th, 2026. You might remember in March, there was what was called the continuing resolution that was funded. That's because they never managed to do a full year budget for 2025. And so now that continuing resolution goes through September 30th, 2025. And now we need another bill for the next year. And this bill, these appropriation bills are about discretionary funding. So defense and other other discretionary budgets like education will be in these appropriation bills. So what the budget, the skinny budget proposes is a 15%, $12 billion cut to U.S. Department of Education, nearly $6 billion cut from K-12 education. He wants to consolidate 18 discretionary grant programs into a single block grant for states. There's some language in there about consolidating 7 grant programs under IDEA, but it's not clear what he means by that. He also says IDA will be preserved. So we're not quite sure what all that means. The block granting, like I said, is more about the Elementary and Secondary Education Act. But, you know, there's a lot in there that really helps our kids too, because they're general ed kids first. So the Title I funding for low-income schools, $18 billion cut, $18 billion in IDA special education funding, $14 billion would be maintained at current levels. But I have to point out, when you maintain IDA at a current level, it's really a cut, because between inflation and increase in enrollment that's happening all the time, getting the same money means it's not going as far. So I just want to be clear that it really isn't, you know, just giving us everything we need by doing this, but it's better than cutting it, obviously. Next slide, please. So what is an IDA block grant? So a block grant means that there would be a fixed sum of funding sent to states without requirements for how the funding must be used, which is very different than IDEA, which has what we call formula grants and discretionary grants, which direct specific uses of funds under IDEA and have specific requirements that states must fulfill in exchange for this funding. Formula grants are calculated based on specific state funding needs like enrollment and various different things. So a block grant would change the amount of funding for states. It wouldn't be looking at what are the needs of individual states. So a lot of states would not get what they need because of that. Next slide. So why is an IDA block grant bad? And really all block grants, a lot of this is true for. First of all, if you take away the requirements in exchange for the money, this will diminish critical protections and rights for students with disabilities, and states may not prioritize their needs equally. I mean, just say in Maryland, they want to do a good job, just say, for our kids. And so they continue to do what they're supposed to do and what they have been doing. But another state may not do that. And it shouldn't make a difference where you live in the country. or where you might have to move, and especially if you're a military family, that where you live will really make a lot of difference. It already does to some extent, which really shouldn't, but this would make it that much worse. It reduces and erodes funding for states to pay for IDA services and discretionary grants. We talked about the difference between the formula funding and block grants, but also historically, anytime anything is block granted, it's just the start of cuts and cuts and cuts and cuts, in the future. It eliminates the federal oversight and accountability that we need to make sure that states are doing and districts are doing what they're supposed to do. It eliminates most of the time any reporting requirements. So there's not the transparency and public awareness that is needed. And it also creates the potential for states just to shift funds to pay for private school vouchers, which we'll talk about why that raises some concerns. Next slide. So what are the next steps for this education budget? So under the law, the president was expected to submit his budget proposal in February. So the process is already way behind, and all we've gotten is a skinny budget, which is just his recommendations, and not the details even on his recommendations. So then next, the House and Senate developed their own budget resolutions to set spending levels, and often that deviates from what the Congress asked for. And then Congress passes the appropriation bills based on these resolutions. And these are required to fund government operations and supposed to happen by June 15th, but that doesn't necessarily happen either. I apologize if you hear, there's a lot of thunder going on in the background here. And then once these bills are passed, then the president approves or vetoes them within 10 days. If the budget has not been adopted by September 30th, as happened last year, then Congress passes continuing resolutions or it just allows the government to be shut down, which has happened in the past. And last year, we kept going from continuing resolution to continuing resolution to continuing resolution. And that creates a lot of uncertainty. And it also wastes a lot of money because the agencies, if they're about to shut down, they have to cancel trips, they have to cancel meetings, they have to cancel all kinds of things. And then the government doesn't get shut down and they have to put all that stuff back in place again. Next slide. So school vouchers and school choice. So there was an executive order in January to expand school choice, aiming to redirect federal funds towards voucher type programs. So we don't get involved in what happens in states with vouchers or a lot of different other school choice options. But what we do oppose is using federal funds for vouchers, specifically using IDA funds and Elementary and Secondary Education Act funds, unless all our concerns are addressed, which is highly unlikely, and we'll state what some of our concerns are. But in addition to just opposing it, we really seek to educate stakeholders and policymakers about the negative consequences of federally funded vouchers for students with disabilities. And there is a voucher policy brief at this link that will go into more detail, but I'll cover a little bit in the next slide. Next slide, please. So some of the problems are, first of all, you lose critical legal protections. IDA does not apply to private schools, so there's no IEPs, there's no free and appropriate public education. I mean, this is true if you have a state voucher or a federal voucher, but it's that much worse if you're actually using federal funding that states are supposed to get for public schools to provide these protections. Private schools are not required to provide the same level or quality as special education services. They have to set aside some money to provide what they call equitable services. And so certain students who may be in private schools may be able to get a service plan, but there's no guarantee that they will get any special education services, no individual guarantee. Many private schools can and do deny admission to students with disabilities. Private schools can easily expel students with disabilities, and then they're back in the public school with less funding because of the voucher programs. They don't have for example, under IDA, there's manifestation determination hearings. Was the behavior a result of the child's disability? None of this takes place in private schools, unless, you know, they decide that they're going to do that on their own. Insufficient funding for expenses. Often the money that's provided for vouchers is not enough money to pay for private schools, especially when they surcharge students with disabilities a lot of the time. So unless you already are wealthy, already have your kid in private school, and this is just a bonanza, you know, some extra money for you. If you are not in a financial position to come up with more money, you know, your kid is going to still be in the public school. And there are a lot of lack of options for rural students. There are, you know, many fewer private schools in rural areas to have options for even using the vouchers. And last but certainly not least, voucher programs divert funding from public schools, harming the students that remain. So, you know, and one of the ways it diverts it is that, you know, you may take these kids out, but you still have to fix up the building. You still have to pay the bus driver. You still have to pay, you know, the staff. You still have to do a lot of things that, you know, taking some students out doesn't change. Also, this equitable funding that you have to keep aside in IDEA for these service plans for some of the students with disabilities, that takes away funding. For the more students with disabilities in private schools, the more you have to put aside for those students that won't be there for the kids that remain in the public schools. And right now, 90% of students with disabilities are educated in the public schools. Next slide. You know, and I do want to say, we understand that a lot of parents, you know, or at least some parents think that private school is a better option for their student. But, you know, we as policy people have to look at the vast majority of students and how that would impact them. Here are some links to some other NDSC policy briefs. ESSA is the Every Student Succeeds Act, which is basically a nickname for the Elementary and Secondary Education Act, and it provides you some tips for using both laws in your IEP meetings, and also some explanation about what alternate assessments are, and we will be continuing to put out more of these briefs. Next slide, please. And these are some advocacy tools from NDSC and Action Alert, and then also some Department of Education FAQs. Next slide. So state and local education advocacy needed. I mean, certainly you want to tell your story at the federal level as well and share it, like we said, with people who live in other states and purple districts so that they understand why this is so important. But the state level and the district level is also very important, because a lot of these decisions may come down to the state. The state funds most of education, but they do rely heavily on what they get from the federal government. So join coalitions on the state level, like the Maryland Down Syndrome Advocacy Coalition, or if you don't have that kind of thing in your state for Down syndrome, other disability and or general education coalitions, so you don't have to go it alone. Testify, written or oral, to state and local school boards, as well as state legislatures. You know, tell your stories, how these different things would affect you. Try to increase your special education budget at the state level, because if there are cuts at the federal level, that's going to impact the overall money that there will be. And serve on special education advisory committees or task force if you can. Next slide. Okay, so I'm kicking it back to Heather here. Thank you.
Thanks, Ricky. Okay, so I'm just going to do really high level discussions of some other things that are going on that are really bad for people with disabilities. If I were to, you know, do many slides, I could talk for hours. And unfortunately, as I said in the beginning, this truly is like a whack-a-mole situation, where just when we feel like we have a, you know, kind of handle on the scope of, you know, one problem, another problem crops up. We're also seeing a lot of deliberately confusing messaging coming out of the administration. You know, the goal, I think, is to overwhelm and confuse people. So a massive concern that we have is what's going on at the Department of Health and Human Services, HHS. And this is under Secretary Robert Kennedy Jr. You might have seen that a couple weeks ago, they announced the essential elimination of the Administration on Community Living, ACL. A lot of people did not know what ACL was before this, and now due to advocacy efforts, they do. But ACL was established back in 2012 in the Department of Health and Human Services, literally as a way to maximize the independence, well-being, and health of older adults and people with disabilities across the lifespan, to coordinate essentially a lot of their benefits and disability programs. Some of the programs that ACL was in charge of, meaning, put out the funding for and where the programs resided, I'm sure you have heard of them. The councils on developmental disabilities, the DD councils. Every state has a DD council. That all came through ACL. Every state has a protection and advocacy organization. In Maryland, it's called Maryland Disability Rights. In most states, it's called Disability Rights. These were literally organizations set up specifically to safeguard the rights and prevent abuse of people with disabilities. The UCETs, the University Centers for Excellence in Developmental Disabilities, that are attached to a lot of the universities, again, specifically to serve the population of students with developmental disabilities, is being eliminated. Many different research projects on, best practices, on competitive integrated employment, a lot of projects of what they call national significance relating to employment first and community supports for people with intellectual disabilities has all gone through ACL. It's been very concerning that, they've announced a total reorganization of Health and Human Services that completely dismantles ACL, that, has proposed splitting up some of ACL's programs and, putting them across different agencies. They're going to try to put some of these under the Center for Medicaid and Medicare Services. Unfortunately, all of this is being done with absolutely no transparency and no stakeholder input. In April, just a couple of weeks ago, 20,000 of HHS staff was laid off, including entire offices within ACL. The policy office is gone, the budget office, grants, engagement in different regions. Again, there's no clarity on what programs are continuing, but even if the programs continue, there's no staff there now to administer the programs. You might have seen that there was just a notice put out today from ACL saying, hey, we're distributing, billions of dollars for these programs. This is all, smoke and mirrors. Basically, what ACL announced today is that they're distributing the money that was already appropriated from Congress for these entities, so for the protection and advocacy agencies, which is only good until September. So we've seen in unfortunately in some news that particularly with some of the protection and advocacy organizations, they have shuttered, or they have put out messaging that they're unable to take on new cases of people with disabilities. Now they're getting their funding, but only through September. So there's a ton of uncertainty still. And, again, it's going to create a lot of reluctance to take on new services. We're hearing Meals on Wheels is stopping. And so it's very, very concerning. What we're also seeing is, a lot of misinformation regarding autism and vaccines. This is a whole other discussion that we can get into. But the main concern here is that a lot of these statements that are coming out, and now a lot of the research that's going to be undertaken, is being done without the input from the autism community. There are scientists and, policymakers and folks that have been working on autism research, whether it's relating to, causes of autism, or just, how to make people with autism's lives better, enhance their quality of life across, healthcare, employment, community supports. This is being done without much input from the autism community. So that's very, very concerning. When we look at Social Security Administration, there's been massive, massive cuts already of personnel and funding for those that are, that have ever had to call the Security Administration or, get information. There have been very long wait lists to actually talk to a person. That's going to be worse now. They've significantly already reduced their workforce, resulting in longer wait times. They've closed down a lot of field offices. What we're hearing is that they're going to be messing with the eligibility requirements, and there are going to be more frequent eligibility redeterminations, both for SSI and also for Medicaid. So for those folks that have had to prove that your loved one has Down syndrome every couple of years and still has Down syndrome, you may now have to prove that every 6 months, which is really crazy. The net effect of that, though, is, a significantly weakened Social Security Administration. Let's go to the next slide. We've been following some cuts going on with HUD. There was a HUD budget released last week yet that actually makes 43 to 44% in cuts to various housing programs, most notably the Section 8 housing, which so many of our folks rely on. Those are housing vouchers and rental assistance in the community. Again, this is just a proposed budget, but this is where the administration stands, and this is going to create serious problems for a lot of adults with disabilities who are living in the community and can only afford to do so because of that rental assistance through HUD, and that rental assistance is going to significantly impact them. Similarly, with the National Institutes of Health and Centers for Disease Control, we're just seeing massive cuts. $18 billion in cuts has already been made. We've seen many different research projects just have to stop in the middle. Many of these are projects that were designed to improve the quality of life for people with, Down syndrome and other disabilities, and they're gone. So things are kind of a mess these days, as you can see. And, there is some stuff that we can do, though. I know it's very overwhelming. Let's go to the next slide. But I really, really encourage all of you to stand up and use your voices rather than burying your head in the sand. Believe me, it is tempting to do that. But we really, really emphasize, the impact of sharing your stories with your elected officials, whether they're Democrats or Republicans. They don't understand a lot of these concepts. These are very, very complicated benefit systems. I cannot tell you how many staffers I've spoken with that don't know the difference between Medicare or Medicaid, and they're talking about massive cuts to Medicaid, and they don't realize that that's the program that supports low income and people with disabilities. They do not know what home and community-based services are, and what impact it has on people's lives. So please share your stories. We talked before about asking friends and family in other states to, particularly red states and particularly purple districts within those states. Those are the folks that have a little bit of wiggle room, that the more their constituents speak up, the more fodder that we can give them to, basically step out of all of the pressure going on right now in the Republican Party. And there is a lot of pressure going on behind closed doors for people to fall in line. We do not want them to fall in line. Please respond to action alerts, stay informed, educate others with accurate information. Ricky and I both talked about how, there's so much misinformation out there, particularly on social media, particularly about the Department of Education. Please share the resources we developed, that explainer that we linked to, and, just get accurate information out there about what is going on in the federal government. In order to do that, you need to have your contact information. So I just threw a link in there. There's a lot of different links that you can find your lawmakers' contact info. And don't just limit it to your, U.S. representatives and U.S. senators. I know that in Maryland, the legislative session for this year is over, but you can absolutely still contact your state legislators just to tell your story. story and tell them about the importance, because remember, when we talked about Medicaid, we talked about how it's a federal and state partnership. So whatever the cuts turn out to be on the federal level, that's going to put even more pressure on the state budgets. So our state legislators need to know what's going on. They need to know about the importance, because when they come back into session next January, there's going to be a big budget battle again. And we need to make sure that they're allocating money for DDA and for our home and community-based services. Let's go to the next slide. We invite you all to join NDAC, the National Down Syndrome Advocacy Coalition. This is the nationwide grassroots program through National Down Syndrome Congress. You absolutely do not have to have Down syndrome or a loved one with Down syndrome to join. We welcome, folks from all different disability groups, or really anyone that cares about anyone with a disability. And through NDAC, we provide things such as, regular policy updates. There's a closed Facebook group where, people really from across the country help each other and provide different tips and advice on that. And so, yes, please join NDAC. Let's go to the next slide. I know that DSNMC is bringing a group to the National Down Syndrome Congress Convention, which we have annually. This year it's in Dallas, Texas, from July 24th to 27th. Registration is still open for that. And let's go to the next slide. And at convention, as part of the for no additional fee at convention, we host an advocacy training boot camp, which is, a half-day intensive training session. We always have a ton of self-advocates participate. We try to make it fun and interesting, and have gotten great feedback that it is very, very empowering advocacy training. Let's go to the next slide. Please register for NDSC action alerts. As I said, those are those template emails that we'll send you. They're really easy. They take 2 minutes. You click through, it automatically populates with your legislators' information. Please send the action alerts to your friends and family. Really easy way to do that. Just, sign up for the action alerts. You'll get an email. Just forward it to your friends and family in red states and ask them to make calls for you as well. And let's go to the next slide. And these are just our social media handles through NDSC. And, we want to hear from you and hear what's going on. I know most of you are in Maryland, but, we certainly don't have the capacity to keep up with what's going on in all 50 states. So we depend on our advocates to really, let us know what's going on. And that is it. So Ricky and I would love to take some questions if you have any.
I'm just getting everything back together here. I have you pinned here. Hold on a second. There we go. I was unable to look at the chat while I was sharing, but I will open it up and I will go through it quickly.
Ricky, I didn't hear you say anything about TIPSID grants. Are the post-secondary programs, I don't think they're a function of Department of Education, but do we know if that's like part of ACL or anywhere in there?
No, they are a function of the Department of Education. I did say that that's one of the things we're concerned about. We don't know what will happen with the grants for TIPSIDs and the Technical Assistance Center or any of that. That's kind of up in the air. That's under the Office of Post-Secondary Education in the Department of Education.
Okay. Do you get the sense that any Republicans are going to come across the aisle and back, the Democrats that are making a case for no cuts to Medicaid or, not going with these block grants for education? There's doesn't seem anybody's going to come across the aisle. Are there people we need to specifically reach out to that are close to coming across the aisle?
I think people are closer than you think, Amy. I think what we're seeing publicly is very different than what's going on behind the scenes. Publicly, everyone is falling in line. behind the scenes, we have heard that the Republican conference is in quote unquote disarray. And, advocacy, it does seem to be working. Particularly, I would target folks in purple districts. And I think probably Kansas City around there, they have, some purple districts for sure. Those I think are the most likely to come around. There's also a lot of information you can get on a kind of Medicaid snapshots per district. And what we're seeing is some Republicans, speaking out where a lot of their constituents happen to be covered by Medicaid. 2 weeks ago, 12 Republicans sent a letter to the Republican leadership in Congress. These are folks that have the highest percentage of Medicaid enrollees in their districts. For example, one of them is David Valadao out of California. Typically would not be considered a moderate Republican, but has such a, something like 60% of people in his district are on Medicaid, and they have been letting him know. We're seeing footage of, town halls, those that are brave enough to have town halls. People are coming out and sharing their stories. And so I think that, the more people make noise about this, the more likely it is for people to, as you put it, go across the aisle or, I don't necessarily think that we're going to be able to stop the cuts, but as I said, if we can minimize the damage, minimize the cuts, then and also to delay. I mean, let's not forget that the midterm elections are just in a year and a half, and there's a very good chance that the House will go Democrat because the numbers are so close, and given all of the discontent that's going on. So I think if we can just kind of throw a wrench into the works until then at least there'll be some sort of a check on, all of these cuts and negative restructuring attempts that are going on.
And it's hard to say, in the Senate as well, like there are people like Senator Collins and definitely Senator Murkowski, who has been fairly vocal about not being happy about some of this. It's very hard to predict what people will do, but people are certainly getting antsy and uncomfortable, and that's what we want them to be. So,
yes.
My last question, and I know we have so many big problems right now, and I know NDSC can't be the word police, but when the president continues to talk about low IQ people and insult in an insulting manner, I want to jump off of a bridge. Like, I don't know what to do. And I don't want to seem unleashed on, I'm very careful on social media or whatever because of the position I hold. But he's vilifying people with intellectual disabilities pretty regularly now.
Not to mention Elon Musk. So,
yeah.
So we have put out statements. We have not specifically said this person is doing that, but we've talked about the increase in this language and, that sort of thing. And but, the fact that it's seemingly acceptable now is a big concern. We share it.
Well, and it is also impacting some policy choices, particularly in the employment area. A couple months ago when that tragic plane crash in DC, and then the president came out and immediately made a statement and said, essentially, I don't have the exact quote in front of me, but essentially said, it's because we hired, people with disabilities in these, offices. And that in itself was just, I just said, oh my gosh, that just set back disability employment, because, obviously there was no one with an intellectual disability who was an air traffic controller, even though he was implying that. But unfortunately, what we're seeing is a lot of the disability employment programs have gotten swept up into this whole DEI thing. In fact, it's now being called DEIA, A for accessibility. And, people with disabilities are now being lumped in with this whole, anti-DEI thing. It is impacting what we're working on policy-wise. For example, in the last Congress, we really were pushing as one of our top priorities to eliminate 14C, payment of subminimum wage in the sheltered workshops, and, pushing bills such as the, Transformation to Competitive Integrated Employment Bill, while that bill may be reintroduced this Congress, we fully recognize that this is not the right time to go for that, that it is not ripe, particularly given now the stigma that's being increased against people with disabilities for employment. So we are seeing that.
What are the chances that these goes without going through the Congress and the Senate? Because we have seen things that passed without Congress or Senate input. Is that possible? Forgive me my ignorance about how the government works.
No, that's okay. So yeah, I mean, everything that goes into law has to go through both chambers of Congress, the House and the Senate, and be passed. And then it has to go to the president, and then the president has to sign it. So there's a lot of opportunities along the way to stall things or to derail certain things. Unfortunately, what we're seeing now through the use of the budget reconciliation process is that things are not happening in regular order. For example, we're hearing that because there's so much pressure to pass these budget bills by Memorial Day, that the Senate is essentially going to just take up the House version of the Medicaid cuts bill. And it's not going to go to the typical Senate committees, that it's going to go through the House and then just go straight to the Senate floor for a vote. And so that's really bad, because when bills go through committees, that's when, amendments can be made, certain issues get worked out and compromises are made. And we're not going to see those compromises as much. So, we're happy to get you some resources on sort of how the government works, but it also just is not a typical time, and they are not going in, regular order.
And what can we do to cause delays?
We just have to keep, we've got to keep the phones ringing, essentially, in our elected officials' offices. As I said, it's more important for the Republicans to be hearing from us right now. So even if you're represented by Democrats, look at where your friends and family live across the country, and anyone in red states, those folks' voices become even more important. We need to let them know that we're keeping an eye on what they're doing, that we're objecting to what they're doing. At the end of the day, they want to get reelected. So, they need to listen to their constituents, and, we've got to just keep raising our voices to do that.
And I want to be clear, because this budget stuff gets very confusing, that Heather is talking about a process that's dealing with the mandatory funding like Medicaid. And so when she's talking about Memorial Day, what I was talking about, the appropriations bill for FY 2026, is the discretionary funding like education, and those are different bills. So there's these two different budget processes on mandatory over here and discretionary funding like education over here that are happening simultaneously. So it gets very confusing.
But that's part of the point, as we said, they want to confuse us. They want to, they want to just, move things through as quickly as possible.
And also know that a lot of things that they just say, we're doing this, like closing Department of Ed, they really just can't do. They can cut all the staff, so there is no Department of Ed that way, but they can't just take it and move it, and so we have to see how the processes
we're seeing a lot of these fights now get into the legal system. Ricky and I are both attorneys, but we don't handle this aspect of it. So there's lawsuits being filed every day. I know that there's now lawsuits relating to the Administration on Community Living that have recently been filed. So these things do take time to go through the legal system, but lawyers are pushing back, and hopefully the administration will essentially start following the rules and do things in regular order, or at least be forced to by the courts.
Thank you.
So I just want to be respectful of everyone's time. especially Heather and Ricky, who have taken this time to give this amazing presentation and update to all of us. There's thank yous in the chat. Just wanted you to know that. But it is 8:30. And for those of, I guess most of us are in Maryland, not everyone, but we are having like a major storm outside right now where I am anyway. And so
Yeah, you guys don't see, one of my dogs is like attached to me, like she will not, she's shaking. And so
well, my daughter, she is not happy about this. And I had to like run in between switching slides to go close my front door. So I apologize if I was late on one of them. Yes, I have a recording here and I do have access to the slide deck, and we'll create a PDF, and we will make sure that the slide deck recording and the PDF is shared.
yeah, and if you guys join NDAC, you'll get regular information like this from us. So please do. You know, let's just all stick together, keep using our voices, keep telling our stories. You know, we fought back before, we're doing it again, and you know, things are going to change.
They have to, right?
Yes.
Anyway, yes, and it's nice to see people from the area, but also from afar as well. I know that Shannon is here from Connecticut, so that's fun too. I know we were talking to Amy earlier, who's from or was it Kansas?
Yes.
Kansas City, Missouri.
Kansas City, Missouri. Okay. So, and I'm just looking around here, and I think that we have one person who is from the area but moved to Ohio. So anyway, thanks for joining in this evening, and thank you, Heather and Ricky, so much. It's been very educational and eye-opening to see, and I'm amazed by what you know. So
And now you can go and let your heads explode, right?
Yes.
I know.
All right, everyone. Well, have a good night.
Thank you.
Thank you so much.
Take care. Bye.
Bye.